It's a beautiful day at OR. You have done a beautiful surgery. Everything is clean, looking nice. Rexus is central, and you have loaded your lens, doing a hydro implantation, thinking of finishing the case and going back home. And suddenly, what is this? Where's the lens? Is it in the cartridge or has gone into the vitreous? So much blood. Suddenly, your mind is racing like anything. There are so many thoughts that come in this situation, and you are like, what should I do now? So let's think along with a young surgeon. First, let us see what happens. Why this hyphema actually occur? So we are doing a hydroimplantation, and suddenly the shooter comes loose and hits the opposing pupillary margin, and you can see the cornea, the corneal wound also has got enlarged because of that. First, you thank God that the lens is in the cartridge and not into the vitreous cavity, otherwise it was a surely case going to a VR surgeon. So what you do, you try to do a tamponade, but you see too much of leak is happening. So you hydrate all the wounds that is there, so that you create a closed chamber first, so no leak. Still you see there is some amount of hyphema that is happening, so you inject intracameral epitrate or adrenaline. Even there, after that, there's some amount of ooze, so you give an air tamponade and you just wait. You thank God that nothing much has happened and pray hard. So you just sit there. This video is playing at 3 times of the speed that it actually happened. So I just waited for 3 minutes. 3 minutes of praying hard that the hyphema stops. And the hyphema actually stopped. So in this time I was chit-chatting with patient. Never let the patient know that some complication has happened, otherwise he will get panicked and BP will increase and hyphema will never get resolved. So now you see there was no viscoelastic till now. I injected viscoelastic, went on with the viscoimplantation of IOL and put it into the bag. Most of the rexus margin was safe, so I could implant it into the bag. But now you see when I start doing the visco removal, the aspiration port actually is not moving, it's the irrigation port that is moving. It's very important not to take the aspiration port towards the torn edges, otherwise it will suck into the torn edge and you can get an aerodialysis. So once the visco is removed, the visco tamponade goes off, you see the lens is getting little bit decentered. So in this case, with little bit of ooze, you don't need to like completely stop that ooze. You again hydrate the wound, do an air tamponade. Air tamponade will stop the bleeding and also keep the IOL in place, and you close the case and again thank God.